Who's this letter friend? Annie Apple says.
Speech is one of many milestones in a child's development, but like anything, there can be a few bumps in the road and sometimes help is needed.
It's common. The speech pathologists in schools are so busy. They will get seen in school. Teachers will, make note of it, and it's becoming more and more prevalent out there. So there's more and more out there that you can access to help. So I think kind of put that embarrassment aside. It's really think about that child and get the child where they need to be.
Having a child with speech challenges isn't something to be embarrassed about. Being proactive is one of the best ways to help your child.
Kids coming in a lot younger, we can start quite early. Usually parents will know about 2.5 years old if they're not quite where they should be. So they're often looking for intervention now, starting from a young age.
There are a couple of signs parents can look out for.
One of the biggest things is if your child is about 2 years old and they're not really using any words yet, if they're becoming frustrated when they're not being understood, if they're refusing to repeat after you or they're refusing to use words, quite often those are signs that something might be wrong. They're really not communicating, not getting their point across, and finding it, people are finding it hard to understand them.
Here are some guidelines for parents. By 2 years old, an unfamiliar listener should be able to understand about 50% of what your child says, 75% at 3 years old, by 4 years old, 80 to 90%, and by 5, almost 90%. As for articulation, these are the speech sounds that are typically mastered in developing children. Every child is different, so these guidelines help parents see where their child is at. There are different approaches to developing language and speech in your child, and Lisa Hansen believes in a multi-sensory approach.
It's a play-based approach where the kids learn through all their learning channels. So we get them to say things, to move, to play, lots of strong visuals. For example, if I've just taught the letter C, the children meet Candy Caterpillar, and the gesture for that is k, 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 k. So if C is one of those sounds that they struggle with, and they can do it on their own, so they can make the k, k, k sound for me, but are still not using it in words. If we come across a word like cow, I'll emphasize that sound and I'll gesture at the same time.
With language and literacy going hand in hand, the earlier you catch any problems, the better.
Then there is intervention, and it can happen at an early age. So I always tell parents that just go and get checked out. So go to a speech language pathologist, call a center up like us to kind of see where, if they can assess and see what's going on, even to fill you up with lots of strategies that you can start doing at home, ways that you can talk to your child to bring out the communication and the language. So I always say if you kind of already suspect something's up, just go get an assessment done or something like that.
If you have any questions or want more information, you can visit www.soundconnectioncenters.com or www.albertahealthservices.ca. For Shaw TV, I'm Tasha Chu.